As part of the cancer care team, it's important for not only us to educate patients, educate ourselves, but also all the members of their team, the medical oncologist, the radiation oncologist, nurse practitioners. I am fortunate to work with a team that is aware of the services that I can offer, and that's not always the case. So you need to market your skills. You need to get out there with referral sources and educate these professionals on what we can provide for cancer patients. So I've been talking about the importance of understanding the medical and the surgical management of cancer patients, and it's important for us to understand the process of carcinogenesis. Carcinogenesis is the genetic cellular transformation of a normal cell into a cancer cell. So all cancers are manifestations of cells gone wrong as far as their relationships with other cells. Cancer cells are our own cells that have had genetic transformations, cellular transformations. Cancer cells are rule breakers. They don't abide by the normal rules of contact inhibition, cellular division, relationships between whether or not these cells should die, whether or not these cells should replicate. They don't follow the rules of apoptosis, that when one cell senses that the information in another cell is incorrect and should be destroyed. So cancer cells, they avoid, they're rule breakers. They don't abide by the normal rules of cellular division. In that case, you can think of that cancer is uncontrolled cellular division. So at some point, a cancer cell enters into the cell cycle and divides. There are no rules, there are no controls on it to stop replicating. If cancer cells move into the blood system, if they move or the lymphatic system, they have the potential to metastasize to other locations in the body. And so that loss of normal growth control leads to indefinite replication. Cells are considered immortal. Cancer cells are insensitive to anti-growth signals. They also have what's called sustained angiogenesis. And this is the ability of the cancer cells to have events happen where they form their own blood supply and are able to invade nearby tissues. And they have all the things that they need. They have the oxygen, they have the waste removal. They are in a perfect environment to replicate over and over again. When I first started working with cancer patients, I attended many cancer committee meetings, many cancer tumor board meetings, and the terminology that would go back and forth was confusing to me. So I do think that cancer cell terminology is important to go over. So when we talk about the grade of a cancer, that is referring to the differentiation. And differentiation is the extent which the tumor cell looks like the cells that it came from. So you have benign tumors. Benign tumors are well differentiated. You have malignant tumors. Malignant tumors are poorly differentiated. They have characteristics that don't look like the cells that they came from. You have anaplastic cells, and those are undifferentiated cells, also considered the hallmark of malignancy. And then you have terms like hyperplasia, which is excessive cell growth and division. And then you have dysplasia, which are deranged cells of variable size and appearance. And those are referred to as your precancerous cells. To put this into an example, a woman who gets repeated mammograms, in some cases, she will be told that she has anaplastic cells or dysplastic cells in repeated mammograms. And in those cases, she is at risk for developing a cancer, and they want to stop that from happening. And sometimes they will put those types of patients on a drug such as tamoxifen, which we'll talk about later, but they'll put them on the very same drugs that cancer patients are having in order to prevent cancer from occurring in the body. So more terminology, a cancer is considered in situ, meaning that it remained in the tissue that it came from. So in situ is when the tumor remains in the tissue of origin. Invasive is when the tumor invades neighboring tissues and sheds its cells into the blood or the lymph of tissues that are nearby. Metastasis occurs when those cells actually enter into the blood, enter into the lymphatic system, and set up shop elsewhere.